Morning. I'm pleased to be chairing today's NQICAN quarterly meeting where we're cascading information on key topics directly to you all. So my name's Vicky Patel, the chair of the NQICAN, the National Quality Improvement Including Clinical Audit Network. Marina, our NQICAN General Secretary, is here with us all today and she'll be speaking at various points throughout the meeting, and it's a really good opportunity to welcome Sonia Kinnair, our new comms lead for NQICAN, who took over from Rebecca Shepherd, who stood down in December. And Sonia can obviously be contacted via our nqi.can1@nhs.net email address for any queries. Microphones are muted, but please do, if you can, pop your cameras on so we can all see each other as the screen allows, obviously. We are going to record the event and make it available to view via the NQICAN YouTube channel. So this means that you can listen to the event again, or certain aspects that you might want to revisit, and you can share it widely with your teams as well. And we'll make sure that we provide the links via our forum and our website, and we'll touch on those later on as well. So Sonia, would you mind pressing record, please, if you've not done so already, and we'll move on to the next slide. So today's agenda that was published for you all, then, it's quite, if you are able to stay for the full event, we've obviously got the next 2 hours together. The chat function's not enabled during the event, and that just allows us to closely manage the time that we've got with you. Make sure we're hearing from everybody that wants to contribute via the Q&A platform, and in addition it allows us to focus as well on the speakers and their content so that we're disseminating that information out to you all. We are looking forward to hearing from you though, so if you'll notice on the slide that there's instructions here, directs you to the question and answer platform within the Teams function itself that allows you to ask questions throughout this event as you actually think of them, so you don't have to save them up till the end. There'll be the opportunity for Marina to put forward any questions submitted to each speaker at the end of their item on the agenda, but we've also got the Q&A session scheduled for the end of the meeting as well, and Marina will lead that session as well, so she can put your questions to the most appropriate speaker to answer them. If we don't manage to answer all the questions or raise them today, we will respond to them via the Q&A document that we will make available post-meeting on the NQICAN website and forum. And of course, HQIP also put their questions onto their website, the questions that they've specifically provided responses to as well. So I think I'll begin with the chair's update, followed by HQIP, then NHS England, and then a brief overview of the quality accounts and the clinical audit section before we move into the Q&A session. So if we could move to the next slide then, please, Sonia. Before we launch into the speaker's presentation, it's just a case of reaching out to you all again today just to check in and get a sense of how everybody's feeling today. And it's just to raise awareness to you again, as we did last time, that we've got this NHS toolkit by NHS employers, really, about asking how you're feeling today. It's an easy to use resource. It's been developed with NHS staff to support us to have more open and regular talks about emotional health. It's available free to use online, so you can access and start using the toolkit to check your own wellbeing or speak to and support your colleagues with their emotional wellbeing as well. NHS employers also have a health and wellbeing network. It's free to join. You can learn from other leaders and teams and share good practice and issues. The link will be active in the slide pack from today, and I think they're holding an event later on in March, a network event that's free to join. So there's quite a lot of health and wellbeing support out there for us all to access if we need it, but maybe it's also thinking again as we break at 1 o'clock from this session about just taking a few moments, step outside, take 5 minutes, take time to catch your breath and just pause before you move on with the rest of your day. Okay, so we'll move on to the officer's update. So you'll just hear from both Marina and I at this point in the meeting. So Marina and I have both been previous regional network chairs prior to standing for the election for the officer roles. We both feel quite privileged to be supporting NQICAN in this way, but we've previously led a regional network, and it's just a point at this time really for anyone that wants to find out how they can get more actively involved in NQICAN and leading regional networks. On the NQICAN website and forum, we've got a routes of engagement and leadership progression in regional networks, an NQICAN document that you can access. It's under the Our Works tab on the website, and it just shows you those routes through the networks up to being able to put yourself forward for the NQICAN officer roles as well. So we'll move on to the next slide, please, Sonia. And I will speak first, and then I'll hand over to Marina, if that's okay. So in case you missed the introductions at the start of the meeting, I'm Vicky Patel, the chair of NQICAN. Been enrolled since October 21. It's been a really good first 18 months within the role, a number of outputs achieved, some of which we'll share with you today. And I also work for Sheffield Teaching Hospitals, an acute provider of health and care within the clinical effectiveness unit. So I'll move on to the next slide and share with you what we hope to cover in today's update. So the slides have been prepared so that they act as a standalone information source for you as well, and they'll be available on the forum and the website. So we do put quite a bit of information into the slides for you, and you can share those with your teams. And as I've said previously, recording will be made available for you. So the forum that we'll refer to throughout, for those not familiar with it to date, it's the NQICAN Network and Sharing Forum. We'll make links available for you throughout the session. Fantastic platform and resource that allows our clinical audit community to link in, really, network, share and learn together. So if you're not yet a member, take maybe that away from today's session as an action to make sure that you join, because we'd love to see you on there on the forum and joining our community. Also, we may have individuals who've joined us today, not yet a member of the regional network, might not be aware of NQICAN's common purpose and forward plan, in particular the improvement priorities. So again, access the forum on the website to find out more information on those, but we will touch on them throughout the information that we're sharing with you. You can find details of your regional networks via the NQICAN web pages. We've held a number of NQICAN events that we're going to share with you today, and also highlight some future ones for you. We want to update you on what we've been doing since we last met with you in December. Quick recap on some of our priorities and challenges and pledges that we've made, and obviously, as always, we try to highlight resources to you of future events as well. So if we just move to the next slide then, please, Sonia. I just thought it's worth a quick recap today, very briefly, of the difference between the open meetings now and your regional network meetings. So the open meeting very much pushes that relevant updates on information to drive our work within our clinical audit for improvement and the wider QI agenda. So very much through the strategic work of NQICAN and those of NHS England, HQIP and other relevant bodies, that national direction of travel. Whereas as we start to move into your regional network meetings, that provides you with that opportunity for all of the organisations of health and care to meet and network, share, reflect and have discussions around your successes and your challenges and learning along the pathways within your integrated care systems. So ultimately aiming to improve and make better that care and services for patient and service users, families, carers, all involved, including our workforce. So we'll move on to the next slide, Sonia, where we'll have a look at where our focus has been since we last met with you in December, so over the last 3 months. Quite a lot of time spent for NQICAN, less time on behalf of NQICAN. Again, that's felt the right balance. I'm sure Marina will touch on that when she talks to you as well. It's been quite busy, as you can see, but just to cover some of the points in a little bit more detail. So in addition to our regular steering group meetings that Marina and I hold, we've met with HQIP as well and had our update meetings, but we've also held some planning meetings with HQIP for Clinical Audit Awareness Week 23, which we'll share a little bit of information with you later, and I'm sure HQIP will do as well. We've reviewed the forward plan and improvement priorities, current task and finished groups and outputs. We've looked at some of the outputs from Clinical Audit Awareness Week 22 as well to inform our discussions for planning for Clinical Audit Awareness Week 23. We've produced 3 monthly e-newsletters for you from the forum and a quarterly one too from NQICAN. Hopefully you're finding those useful, but please do drop us a line via the forum or the nqi.can1@nhs.net email address if you've got any suggestions regarding either of these newsletters or obviously future events as well. So we've been holding some more one-to-one meetings with regional network chairs as required to further support this whole new model of delivery via the NQICAN open meetings, and how the regional network chairs are really starting to reshape their membership to align with some of these changes. And Marina and I have obviously continued to support some regional networks who are currently seeking individuals to express an interest in becoming the regional chair, deputy, or joining steering groups as well, to help to lead and support those networks. On behalf of NQICAN, we've not actually had any specification development meetings since we last met in December, but we've got 2 lined up over the coming weeks. And these are where we're getting a new audit that might have been identified for commissioning, or a current audit that's due for recommissioning, and meetings convened with key stakeholders to review and shape that audit. And NQICAN are a seat at that table, and we have a voice for our audit community that contributes to those discussions. NHS England's Executive Quality Group Clinical Audit Subgroup. Again, NQICAN are invited to provide a local audit voice to those discussions, and we've met once since we spoke with you in December, but I'm sure NHS England will touch more on some detail behind that group. And also the National Clinical Audit Implementation Group, we've met twice now since December. Sarah Chesel, one of our co-opted members who was the previous General Secretary, she and I were invited to an interview as part of the Department of Health and Social Care review of medical technologies and equity to access. So that was nice to actually be invited to contribute where the clinical audit community are adopting some of these medical technologies into our organisations and then measuring them. There's a report to be published in June around that review for anybody that's interested in accessing that, and that will be via the Department of Health website. HQIP also introduced us to a project lead for a funded equity in quality improvement project, and John Ford, who's leading that project, has agreed to attend the June open meeting, NQICAN open meeting, to share the project plans and how NQICAN members could get more involved and contribute to that project. So hopefully you can join us in June and hear from John directly. So it's been a busy 3 months, as you can see. So we're just moving on then. Making data count then. I'd encourage you to access some of these resources. Sam Riley, the Director of Making Data Count at NHS England, she hosts a suite of resources on the NHS Futures platform, training on the steps from 1 right through to step 9 that they're currently developing. So NQICAN have felt quite privileged again to have run a number of events with Sam and her team on utilising clinical audit data effectively for improvements in health and care. And I've recapped here on the slide with links to recordings and slide packs for anybody interested in accessing any of these events. Sam first attended NQICAN back in 2018, and Carl, who was the NQICAN chair previously, has obviously promoted the Making Data Count quite widely within our regional networks. Sam has since held 3 further webinar events now delivered jointly with us, and we are planning the next one as part of Clinical Audit Awareness Week 23, so watch this space. So if we move on to look at our NQICAN's infographic user network meetings, then if you've not had the opportunities yet to join us for these events, you can access the latest recordings on the link provided via the forum. It's a great user group that meet to share and discuss using infographics to promote clinical audit for improvement, but also in a way to share audit findings, perhaps develop newsletters and more. Carl Walker's shared presentations as part of these network meetings on translating and presenting data via visuals, just to have more of an impact, getting messages across to decision makers and wider audiences. So we'll let you know the date for the next event, probably to be held in May. So we'll move on to talk about the Academic Health Science Network then. So in December's open meeting, the AHSN joined us to share a collaborative piece of work that NQICAN are working with them on, a suite of webinars to be run through 23-24 for the clinical audit and wider QI communities on how we're adopting the NICE approved medical technologies and how we're then measuring how they've impacted on patient care. So we've continued obviously to meet with them through this last quarter to plan this series of workshops, and the dates will be published soon, and you can book onto those via Eventbrite. If you missed the December meeting, go onto the forum or our website, access the links, listen to the recording, have a look at the slide packs, just so that you can refresh yourself on what we're hoping to achieve through that work stream. So we'll move on to the next slide and have a look at Clinical Audit Awareness Week then. So obviously the dates have now been announced. As you know, it's a week for us sharing and celebrating, showcasing where clinical audits really made that difference to the quality and effectiveness of health and care provided to our patients and service users. 19th to 23rd of June 23, and NQICAN are busy planning to run a series of lunch and learns daily between 12:30 and 1:30 to make sure that you're saving those dates and times. And then obviously you're all aware, and hopefully you're aware, that there's a launch event planned for Thursday the 30th of March via Teams, and the link's out there. You can head on over to either NQICAN or HQIP website for further information. And it's probably just worth mentioning at this point, if you want to refresh yourself on last year's events, you can access the slide packs and recordings again via the NQICAN website and forum. So I'll move on to talk about the 11 regional networks that we've currently got. If you a nudge again, if you're on the call today and you're not yet a member, head on over to the forum or our website and you can get in contact with your local chair, or alternatively you can email nqi.can1@nhs.net and Sonia will put you in touch. But just to run through them very quickly then, we've got Cumbria and Lancashire, we've got Catherine Dunn as our chair there, we've got the North East Clinical Effectiveness Network, Jordan Thompson's currently the chair, Mersey Quality Improvement and Clinical Audit Network, Sarah Byrne. We've got the Greater Manchester Clinical Audit Network, currently without a chair, and we'll be going out for expressions of interest soon. So if this is something that interests you and you're in that region, watch out and you can put an expressions of interest in. Yearn, we've got Jan Micallef and Zoe Lowe that are now the two newly appointed co-chairs. Midlands Effectiveness Audit Network is Di Lynch. East Midlands, we have Craig Short. East of England, we're currently looking for a new chair, and again, expressions of interest are about to go out. London Quality Improvement, including Clinical Audit Network, we've got Layla Gregory. And the South Central, South East Clinical Effectiveness and Audit Network, we've got Moj Ghonsani. And then our South West Audit Network, Swans, is Leslie Lawson-Kinross, and she's just about to go out for expressions of interest to hand over to a new chair as well. So it's a nudge again, access that Routes of Engagement paper on the NQICAN website if you think that you might be in a position to step forward and submit an expression of interest for any of the leadership roles within any of the regional networks as well. Okay, so we'll move on. So co-opted members then, really pleased to announce that Kerry has joined NQICAN as a co-opted member for 12 months, and she's going to lead the task and finish group for measuring success in our local programmes. Kerry's the head of QI at Nottinghamshire Foundation Trust, and until recently she's had a lot of clinical audit experience as well. She will further promote how clinical audit is a QI tool and can bring in that wider QI agenda as well. So Kerry will be in touch with our community via the forum while she's looking to get wider involvement in that task and finish group, which is an improvement objective included in our NQICAN forward plan. And we'll hear from Kerry at the opening business meetings as we move through year as how she's progressing with that improvement objective. Okay, so I'll move on to talk about some of our events that are coming up in the next few months then. So obviously March the 30th, we've got the Clinical Audit Awareness Week 23 launch event hosted by HQIP, and NQICAN will be joining that session and contributing to it. April, we're promoting a number of the NHS Making Data Count training events. They're held in their workspace via NHS Futures platform. In May, we're hoping to host that further infographic users network event, date to be confirmed. And then in June, obviously, we move into Clinical Audit Awareness Week. We're running a host of that suite of lunch and learn events, alongside maybe some further events during the week that will be announced with links shared more widely. And then obviously the June Open Quarterly Network meeting to be held on the 29th of June, booked via Eventbrite as usual. So as part of the NHS Fab Changes 20 to 23 initiative, we, NQICAN, made some pledges and challenges as part of FAB changes process to move to year-long continuous change rather than just having a week in time. So each quarter we try to reflect on these and have a look at where we're trying to push ourselves so that we're really driving our improvement agenda for our local communities. We've got quite a bit here. We've split it by officers, regional network chairs and our co-opted members, so you see that you can see exactly what we're all doing within our roles to support you on the national level to make that difference back in your own organisations. So it's another nudge, I think, really, is to ask you all, have you made your pledge yet, and to actually join that NHS FAB changes and make sure that you are pledging and promoting how we're sharing more within our improvement community and how we intend to make things better. So at this point, I think I'll hand over to Marina and let her give you an update from her General Secretary role.
Thanks, Vicky. Yeah, for those who don't know me, so I'm Marina Otley. I'm the General Secretary for NQICAN. I've been in this role since the 1st of November. In my day job, I work for Nottingham City Care, and a couple of years ago, I was the chair for the East Midlands region. So just to give you a bit of an update, a very whistle-stop tour of what I've been up to since we last met. Obviously working on the reimbursements. So our 22-23 position for reimbursements, our budget at the time has been 34,610, and by year end we're expecting to spend 24,630 of that. Our annual reimbursements plan has been agreed with HQIP and NHS England, and our budget for 23-24 is 30,958. Recognising that obviously the financial pressures on the NHS. So we've also obviously been doing the Q3 declarations of interest. So this is a quarterly declaration that all of those on NQICAN do submit to let us know any potential conflicts of interest. We've been obviously working on finalising the Q&A from December 22, and obviously, as Vicky said, after each of these quarterly open meetings, we do publish that Q&A document for anybody who wants to go back and check on those. As Vicky's mentioned, we've also been reviewing expressions of interest for things like the co-opted members and those who are interested in other positions. So that includes the New Yorkshire co-chairs as well. I've been working on updating the governance document. Vicky and I have been backwards and forwards a number of times on that. So you might notice on the NQICAN website that is still currently version 11.4 if anyone wants to check that out. And we are working on a major update of the governance document. As soon as we've got that, obviously that will be made available. And available through the forum and on the website. And as Vicky said, we've been starting plans for Clinical Audit Awareness Week 2023, which is very exciting, coming up soon. So very quick whistle stop of my role. Obviously, if anybody has any questions, do put them into the Q&A. Thanks, back to you, Vicky.
Lovely, thanks Marina. So I think, as always, we're giving you the dates for the next meeting so you can get these in your diaries now and work with us to spread the word, share, network and learn, and obviously encouraging you to join your regional network and join the forum if you're not on it already, and then obviously head on over to the NQICAN website and follow us on Twitter as well. So if we go to the next slide, I think we've got the opportunity briefly for any questions that might already have been put on the Q&A. Marina, have we got anything coming in as yet?
We have just a couple of questions there, Vicky, for you. So the first question was, is there any update on filling those empty regional chair posts? And obviously you've provided an update on that already. So the Yorkshire network has positions have obviously now been filled, and Greater Manchester and East of England are going out for expressions of interest very soon. Is there anything else you wanted to add to that, Vicky?
No, just to remind that obviously Swans are going to go out as well. Leslie's going to go out for expressions of interest so that she can now hand over that chair role as well. So yeah, if you're in any of those regions and you feel that you're in a position to put yourself forward, please do. And obviously if you want to know more about being a chair for those particular networks where there isn't a chair in place, just contact us via that NQICAN email, and if you want to have a quick chat with Marina or I at all.
Yeah.
Brilliant.
Next question we've got, is any clinical audit team completing NHS benchmarking projects as part of clinical audit priority programmes? I think it's more of a general question to those attending. So if anybody feels that they'd like to respond to that, obviously do so. You can do so under the question that's been raised in the Q&A. That's one of the advantages of the Q&A, is that you can actually respond directly to that question that's been raised, if anyone would like to respond to that.
Thank you very much. Thank you, everybody else, and good morning. I'm Helen Barron, and I'm starting the update from HQIP, so the Health Quality Improvement Partnership. I was going to say that you'll hear from Caroline and Kim later in the presentation, but you've already heard from them. So happy to move on to the next slide, please. That's great. Thank you very much. So yeah, just to say that HQIP's an independent organisation, and we work in partnership with patients and healthcare professionals to influence and to improve healthcare practice. And our update this morning will cover various strands of our work, activities, initiatives, and resources as well. So I'm going to begin by giving a very brief update on the NHS England Quality Accounts list, the directory, and a little bit of an update on the NQICAN subscriptions activity. So again, happy to move on to the next slide, please. Thank you very much. So the NHS England Quality Accounts list for 23-24 has now been published. So the final version of the list is available on the HQIP website on our quality accounts page. And that's alongside the list for this current financial year, 22-23, and some other more sort of general information relating to quality accounts more broadly. Next slide, I think. Thank you. So yeah, in terms of the directory, for those that don't know, the directory is an Excel-based information document designed, I guess, to be used for guidance in trusts working through their quality accounts reporting. The directory is produced by HQIP and includes high-level information, not only about the HQIP Commission projects, including NQICAN, but along with other sort of national quality improvement projects that are operated by other organisations and other audit providers. A new version, an updated version of the directory was recently posted on our HQIP webpage, and I signposted that on the NQICAN online forum as well. So this is a revised version that follows quite a comprehensive annual review process, where we asked all audit provider organisations to complete a survey to update the information that was included in the directory, not only for the remainder of this financial year, but also to add information for the forthcoming 23-24 financial year. And I'll continue to update the directory on probably a monthly basis going forward. Worthwhile noting that the new version of the directory also includes a couple of changes to some of the fields, which were a result of feedback, I think maybe through this NQICAN open forum meeting. Happy to have the next slide, please. That's great, thank you. So yeah, just by way of an update on NQICAN subscription funding. So recent progress update shows that for this current financial year, I actually think we've got 99% now of trusts who have been invoiced or have provided their purchase orders to us. So that's following another update yesterday. And for the forthcoming year, so for 23-24, we've added a little update statement on our website, really stating that NHS England have indicated that the standard subscription fee of £10,000 per annum will apply again for the forthcoming financial year, 23-24. And we are planning to write out to trusts early next month, at the beginning of April, to request purchase order numbers as we've done in previous years. I think that's me by way of my update. Thank you.
Thank you. I think it's over to me. So I'm Caroline Rogers. Good morning, everybody. For people who don't know me, I'm one of the associate directors at HQIP, and I am attend these meetings with NQICAN and working with NQICAN in that role. So we've got a number of tenders going on for National Clinical Audit and Quality Improvement Patient Outcome programmes. The National Child Mortality Database, we went live with a tender exercise in January and February, and bids are now in, and the bids will be assessed and the winning bidder awarded. There is due to be a new programme, National Eating Disorders Audit. We haven't got a final go live date, but it's expected in the coming months, and we welcome bidders to that programme. And we have awarded the National Respiratory Audit Programme contract. So a summary of our procurement activity. Next slide, please. I thought there we go. So here's a flavour of some of our recent reports. All the reports are on our website. That's only a couple there because it's a long list. Oh, I should say that we have prepared a document to go with this presentation, which has got all the details on, with all the links and with all the names of all the reports and everything else we're doing. So that be part of the meeting papers for this meeting you can access. So one thing I wanted to point out is you'll see this new term State of the Nation report. One by one, audits are going on to what we're calling a new style of contract, and there are a few differences between the way we used to our expectations of the audits previously and new expectations, and those new expectations include a shorter State of the Nation report. I've talked about it previously, so that's the idea that each audit or programme will produce quite a short, there's supposed to be a small number of pages, or a 10-page report with that high-level summary with national policy recommendations, with an executive summary and with a summary of the data. And that's a short report available, accessible to everybody. Then within that, the expectation is it's a layered approach, so there'll be links to that further data by trust or by region, or however each audit is divided up its data. So there'll be that further detail available on the website, so anyone can dig deeper if they're interested, but there'll be that high level report as a summary. So one by one, you'll see the audits starting to release these State of the Nation annual reports. Accompanying that, the expectation is to release more regular, more timely as they can get it, data disassociated from the report. So there'll be that regular release of data with the annual State of the Nation report on top. So things reporting will look a little bit different in future, and you can go and investigate the various topics with the link there. Thank you. Next slide, please. Oh, yes, Clinical Audit Awareness Week. Right, we're really excited about this. We just had a meeting this morning, preparing and planning this with NQICAN. So dates for your diary there. We've got 19th to 23rd of June. I know Vicky's mentioned them, but just to make sure everyone's got the date. And next Thursday we'll be launching the whole event with a shorter event at lunchtime, talking about the week, talking about the Audit Hero Awards, and launching the criteria for those awards. So you've got the names of the Audit Hero Awards, and we encourage entries. They'll be open from next Thursday, and if you can't attend that launch event explaining it, we will record it and release the recording, and the closing date will be the 7th of May. So we look forward to lots of entries, and the winners will be announced during Clinical Audit Awareness Week. So hopefully something for everybody. Can I go on to the next slide, please? I've probably covered some of that. Yeah, so every day during Clinical Audit Awareness Week in June, there'll be an hour's event, so an interesting speaker on the topic, and the presentation of the award. We'll be providing updates, and we'll put everything on social media so people can follow what's going on, and there's our link to the website for Clinical Audit Awareness Week. Thank you. Next slide, please. Clinical audit benchmarking. Yes, so for those who aren't familiar with it, do go and investigate the National Clinical Audit Benchmarking website. This is updated continuously. The CQC do a lot of this work with us, and I've noted here that recent projects, there's recent data from each of the following projects in the last couple of months. So the bowel cancer audit, National Neonatal Audit Programme, National Ophthalmology Database, and the Maternal, Newborn and Infant Clinical Outcome Review Programme, and the National Audit Breast Cancer in Older Patients. There's an email address there for feedback. We know the feedback is always can it be quicker, and we have really tried to take that into account and work both with the audit providers and with the CQC to get this data up there as quickly as possible. It does sometimes take a while for data to come through from the various sources that it's all compiled from. It's not just the hospital's own data, but when they link it to HES data and National Office Statistics Office data and all of that, sometimes takes a while, but we are mindful that people are keen to have it as quickly as possible, and certainly keen to have it as quickly as possible as the data is released in other places where it's released, as well as on the clinical audit benchmarking site. So we are certainly doing what we can to make sure that data goes up there regularly. Could I have the next slide, please? Yes, as you know from the last presentation, that the audit data, or some of the audits, have their data on the Model Health System portal. We know that that is restricted, but I think everybody with an NHS email address can access data there, whereas clinical audit benchmarking anybody can review. And I think all I want to say was this, that we're currently reviewing the outlier policy across the National Audit Programme, and particularly bearing in mind this time ways in which non-participation in audits can be addressed through the outlier policy. And the other aspect that we're looking at the moment is how excellence in the audit programme can be highlighted. So a couple of new themes that we're building into our review at the moment. And I don't know if Helen wants to say more, but we held a workshop in November on the clinical audit benchmarking, because we know people are using it and it's helpful, just looking at where all the data is released, how timely it is, and what we can do to get those data flows through the system and published on the clinical audit benchmarking website. So quite a lot of work going on in that area at the moment. And I think I'm going to, unless Helen wants to join in on that one, I will go back to Kim, please. And next slide, please, I should say.
Right, can you hear me? And also, just to say, Caroline, I spoke to Susan, who is our project manager for NCAB, and she is planning to join the next NQICAN meeting in June. So I think it should be great.
Oh, excellent. So she'll be there for any questions that anybody has or any more detailed review. Lovely, thanks.
Exactly. Okay, so over to me for a patient and care engagement update. I have told you that we are leading on the PPI element of the National Obesity Audit. We've put together a user panel who are a group of people with experience of services from diverse backgrounds throughout England. So we're currently working with this group to co-produce outputs for patients and carers about the audit. So hopefully that will be something that will be coming out over the next 12 months. This quarter, in terms of commissioning, we've been engaging with people and communities for the upcoming mental health clinical outcome review programme. A specification development meeting is being held next month, and I ran a focus group yesterday with a number of people with lived experience, so I'll be collating that feedback for the SDM. We've also opened up membership of our service user network, so that launched over sort of Christmas, New Year. So I really encourage NQICAN members to share the link and encourage their patient and public community to sign up to hear about involvement opportunities, not just with HQIP, but all sorts of national bodies that have QI opportunity and PPI opportunities. So please continue to use our resources. We've got a lot of resources on our website about engaging with patient and carers. Please make use of those available resources. And if you've got some good examples, make sure you share them with me. And I'm really looking forward to seeing some really good submissions in this year's Clinical Audit Awareness Week and the Audit Heroes category. Okay, just some other information from us. Our independent user research has told us that people would value a place to share or seek expertise on practical issues around understanding and taking appropriate action on NCA recommendations within the wider context of everything else that we know. So we are working in partnership with NHS England, NQICAN, Royal Colleges and other partners to develop this hub, the National Clinical Audit Learning and Knowledge Hub for the clinical audit community. So this is a platform for bringing together the clinical audit community to share expertise and insights on utilising national clinical audit to improve patient care and services that we provide. So if you have expertise in any of these areas listed here, there's an email address at the bottom, and as Caroline says, we have got a Word document that will be shared with you with all of this information. So we're looking for people with expertise in all of those areas, and get in touch with that England.improvement delivery address to let us know if you'd like to be involved. Okay, so next slide, please. So also in a recorded presentation, our Associate Director Yvonne Sylov talks through our data sets and our data access process, as well as highlighting top tips and common pitfalls in applying for data. So we also have an additional resource in the form of a leaflet, also co-produced between Yvonne and the Health Foundation, and this has been added to our data access request pages, which shares top tips for using linked health data sets in research. The web link is just there. Next slide, please. And also from our Dr. Yvonne Sylov is an article about the invisible power of health data. It explores how data saves lives and how explaining this to patients can be very tricky but rewarding. And the article is featured in our HQIP magazine, which was out last year, Cornerstone, and it also includes information about the national data opt-out. So please use that link, please access the magazine, we're really proud of that. Next slide, please. So other HQIP news. We've been awarded the NQICAN contract by NHS England following a competitive tendering process. The new contract will begin in April, 1st of April, and will run for 3 years with an option to extend for a further 2 years. Information is on our website for that. And also big news, after 10 years in post, our CEO Jane Ingham is retiring. So there's adverts we've been posting about looking for a new CEO with outstanding, progressive and values-based extensive knowledge and experience of healthcare quality improvement. So please do share at that advert so we can have as many applicants as possible. Last slide, it's just open for questions and all our contact email addresses there. Do we have any questions?
There are some questions in the Q&A. I'm sorry, I haven't got the agenda right now for a minute. How long have we got for questions?
That's all right. I've got the questions up ready for you.
Oh, brilliant.
Okay, so the first question was the RCEM projects on the quality account do not appear to align with those currently in progress.
Is this Royal College of Emergency Medicine? Yeah. So the Royal College of Emergency Medicine audits aren't part of the national audit programme, are they?
No, they're not.
From what I know. So I don't. What's the question? They don't align.
Yeah, the RCM projects
give us more detail. They probably don't align in that they're not within the national clinical audit programme. I
think they're so they're not on NQICAN. But
they're not in the NQICAN.
Yeah,
no.
They're on the quality accounts list, and I wonder if in the published list of the topics different from what's on our NQICAN website. Maybe we ought to just have a
line. So a bit more detail on the question. So I'm sure people know this, but just so there's a set of national audits that commission funded by NHS England, the Welsh Government, commissioned through HQIP that make up the NQICAN. The RCEM audits are outside that, so there are other organisations, professional bodies that run their own audits, so that we HQIP don't oversee and don't commission, and that's one of them.
Thanks, Caroline. Yeah, that also leads into the next question, which is does the HQIP subscription include all the audits on the directory yet? Is there a reason we have to pay even more to take part in some audits, e.g. RCEM audits, rather than just having it all paid in one?
Yeah, so it's exactly that. The subscription is for the programme of national clinical audits set by NHS England and the Welsh Government. The directory is we tried to compile a list because people thought it would be useful of all the audits that exist, and you can filter by which of those are part of the NQPOP commissioned as part of the national programme and which are outside that. So, and there may be a charge from what I understand for some of those other audits. I don't know if Helen wants to add a bit more to that, but I think that's how it runs.
Yeah, no, nothing more, just that it's an NQPOP subscription charge. Yeah, it covers NQPOP projects.
Okay, and then final question, is there any further updates on the progress of more NCAB audits being moved onto model health? Is the plan to close down NCAB in the future once this transition is completed?
I can try and answer that. Or Helen, did you want to say anything on that?
No, it's not something I know very much about, I'm afraid.
So I don't think those plans have been made yet. So at the moment they're on both, particularly because, as I said earlier, NCAB is open to anyone, so anyone can access and look at the data, whereas model health, is restricted access. So if we wouldn't, at the moment, we're not planning to take things off NCAB, because, as I said, because it's open to everyone. However, I don't know if that will change in the future. I know it's a question that obviously we need to consider. Is there duplication there? Is there some redundancy there, and do we need to look at that? So I know it's been considered, but I don't think it's, or if I don't know if the decision's been made on that. So that's the reason for that at the moment.
Thank you. That's all the current questions we've got at the moment.
Well, thanks, Marina. So I think we'll move on to NHS England's update then, and we'll let Helen introduce herself, if that's okay, Helen.
Yeah, thanks, Vicky. Hello, everybody. Delighted to be here today. Just building on from what you've just heard about, I'm going to be talking to you in a little more detail about this premise of having a National Clinical Audit Learning and Knowledge Hub, mainly about applying those practical recommendations into practice. And I'm going to talk to you a little bit about some user research that we've done to inform what we're doing, and also an appeal for you to get involved and help shape this further. So if we go on to the next slide. What we wanted to do is not just set something up, but actually understand what people need. So we've established a shared vision and purpose. We've taken a service design approach. Interested to know if anybody's been involved in service design. Essentially, this is looking at what people need and marrying those needs up with, say, organisational needs to come up with something that's really beneficial. And from that, we've created some personas. They describe typical users, and I'll show you them in a little more detail later. And it'd be really interesting to know if they resonate with you. These personas have names. They're not based on real people. They're sort of typical users. We've got the names on the screen there: Claire, Michaela, Dixie, and Mahmood. And I'll also share with you some of the requirements that we found thus far for this learning community. Before I go any further, I just want to make it really clear that this does not aim to replace what's there already. We know there's a lot of good work that's going on. I'll just pause whilst we make sure the slide is in sync. I'm looking at one that's got yeah, that's the right one. Yeah, if we go into that one. Let me just go back to my train of thought there. Yes, I just want to make sure that this isn't designed to duplicate what's there already. It's very much around complementing what is there. And so we've been working with an implementation group for improvements, which includes Vicky and others from NQICAN as well as HQIP. And this is the original shared purpose that was drafted. So I just want to point out a couple of things from there. On to the next slide. So we wanted to understand what people needed. So the original ask, I think, was from the National Clinical Audit Governance Group at NHS England. And so we have this implementation group working with partners. We agreed the shared purpose. And the approach has been to bring in service design expertise, which has largely been through doing a survey. That survey went out end of last year. Thank you for those of you who responded to it. That's been really super helpful to inform this work. We've also been conducting interviews as well, and also bringing evidence from literature too. And we've done a couple of things, which is to do something called user journey mapping, which maps out what people are trying to do throughout clinical audit and the various touch points through that. perhaps post-meeting I can share the link with you all that shows the map. That's something that we're continuing to build on. So if you have any inputs to that, that would be really helpful. And the personas really show what typical users are trying to do. Now, you may think, well, this is quite obvious. We all know what people are trying to do with clinical audits. But I think what this just helps us is just to ensure that we're using an evidence-based approach, and helps to inform and shape our thinking as well. And then in terms of the implementation, we've been working with the executive quality subgroup at NHS England to share this work. We've already got a future site that we've started to build, and that's been tested, but it does need some more work to get it where it needs to get to, hence we need your input. And we also are developing further content as well. The aspiration, I think, is to have some associated events and sessions around this learning community, and also to align with other activities that are going on. So that's what we have been trying to do, and it's great to see this slide actually, because it shows that we've done a lot in the last 6 months or so. On the next slide, here are some of the high-level findings that we've got from the user research. There's a lot more detail that we have in the background, so if anybody's interested to see that, I can share with you. So people absolutely want to signpost to resources that are helpful around implementation, highlight topic experts and services that are doing well. Peer-to-peer support is also something that's important, networking, and also from hearing what's been going on this call, obviously there's a lot already going on there, but perhaps there's some more focused support that might be helpful. We've discovered as well that the word peer-to-peer sometimes has different perceptions around what it actually means, so that's something we also need to unpick. But the premise is people want to really share their solutions around implementation. As well as that, also I think there's something about, if there's something that is emerging, perhaps like real-time data, people want to learn around those priority topics, around culture change as well. And I think what we've had a steer from the implementation group is, you know, we do need to focus this down a little. So for instance, sharing improvement plans is one thing that we see a perceived gap. I'd be interested to know if you see that as well. On the next slide, this is just a very, very early preview of this online community, which we do want to have more people involved to ensure that it gets to where it needs to get to. So I don't know how much people use Future NHS. This is the collaborative platform. It will mean that having a presence on there will mean that National Clinical Audit reaches a wider audience. You know, we run some other Future sites, and I think we have a very healthy numbers of page views and so on. So there's an opportunity if we surface content on Future so that it can get shared wider. What we're seeking now is people to contribute their own insights, share improvement plans and resources, join us on conversations to help us to just expand the content, and help us influence alongside other people as well. So that's where we're up to with the Future site. And on the next slide, we have these personas. So I'm really interested to know what people think about these and if they resonate with you. So we've got these 4 personas. We're also developing some further ones. We've found through this user research that there's a really keen interest in learning how others have implemented recommendations from National Clinical Audits, and there's an interest goes beyond people who are actively involved. These personas include Claire, Michaela, Dipsy and Mahmood. These are just names we've given them. If you by any chance are called Claire, this isn't necessarily about you, but it's about, say, for example, others who are involved in clinical audit. What you can see is these typical users have varying needs. So, for example, Claire is really to make sure that audit improvement actions are as easy as possible and needs to learn from others about applying recommendations and also raise awareness with colleagues. Michaela is somebody whose patients come first, doesn't have much time to get involved in clinical audit, but really needs to see the benefits of that involvement. And Dipti is someone who is keen to get involved, particularly for helping her career development, but really needs to understand the process. Mahmood, who we've called a domain expert, is someone who's really knows their service, has a lot of expertise and ideas to share, and needs to make a case for resources to transform services. So do post in the Q&A if you've got any thoughts, reflections around these personas. I think it's fair to say that when we've shared these previously, they did resonate with people, but we found that we do need some more, for instance, lived experience, people involved in transforming services who might not be as involved in clinical audit, and operational managers, for instance. On the next slide, I'll show them in a bit more detail. What we've also found actually around these personas is that they can be helpful in other contexts. So, for example, for audit providers who are developing their own websites or services. And so that's what we're also doing in the background, is to share these personas so that they can be used to help others thinking about what they need to do in terms of the services that they're developing. So if we go on to the next slide, this is some more info that we've got about Claire, and it really shows around, you've got some words on the left-hand side that shows Claire's enthusiasm for clinical audits, what she's trying to do, which is really to make sure that those actions are identified and addressed, and some challenges that she may have. For instance, communicating the importance of taking part in audits. And her role really, or a lot of the work that she does, is around making those audits and actions as easy as possible. These personas, there's sort of a piece around then having to do a translation piece around how these personas, what do we need from a learning community to help meet these personas' needs, as it were. On the next slide, we have some more info around Claire. So we've got the findings from the survey, which shows around appetite for using features, the specific activities that Claire's doing, and her user needs. So it shows that for this persona, learning from peers is and others is important, and that's helped us to inform what we've done to date. I'll show you the next one, which is Mahmood. So with this typical user, is someone who has a lot of expertise around his service or their service, really trying to make sure that those audit requirements are completed, may have some challenges around resourcing, will have to lead maybe a team around implementation, also time pressured, so has to balance that time with delivering patient care as well. And so we feel that this persona means that there are people out there who've got some really good ideas and ways of implementing findings for clinical audit, and it's how to tap into that. We know that some of it will already be captured through Clinical Audit Awareness Week, through the work of NQICAN and HQIP, but is there anything that we could do to amplify those sort of examples, or are there any gaps that we need to share? On the next slide, you've got a bit more info about Mahmood. And again, it shows appetite for sharing on there, what they are trying to do, and their needs. So I think there's a consistent message that that learning appetite is there, and that's what we were not quite sure about before we started this user research. I'm not going to sort of talk about all the info on this slide, but of course they'll be shared afterwards. And if anybody's wants to have a further conversation with me about these personas, we're happy to do that. I'll just quickly go on to the next slide, which has Deepti, who is somebody who is perhaps a bit newer to clinical audit. Actually won't necessarily see, if she gets involved in clinical audit, won't actually see the impacts on that, and I think that's sort of a really interesting point. She's focused on ensuring that this will help her career development, so there's an opportunity there, isn't there, to ensure that that premise around making sure that the implementation of findings really is part of her development as well, because she'll be someone who'll be a perhaps a leader in the future in terms of the health service. And on the next slide, we've got some more information about this persona, and I think some of her or their needs are likely not to be met by this learning community, but elsewhere, which is in terms of things that are already in place, particularly around understanding how to do a clinical audit, how to access the various IT systems, how to conduct surveys, etc. And I think the final persona, which I wanted to share with you, is Michaela. So this is another typical user with patients, really wants to see how audit is beneficial and also see the link between the improvement actions and the audits that triggered it. And on the next slide, we've got some more information about Michaela. I think they just pose a slight challenge, doesn't it, when we talk about things like futures in terms of the time to get access to futures when people are very, very busy. So that's something we'll have to factor in. But you can see that she's got some particular needs around explain to others around or interacting with us around audits, being able to learn from others as well. So that's a whistle-stop tour around these personas. And on the next slide, you'll see that we actually want to develop a few more. So this is an appeal to you. We've not got an awful lot of time to develop these next set of personas. So we need to find people to interview or have a short conversation with. It's nothing too onerous, but we do need to find people in these categories so that we can craft some further personas that will inform what we're doing. So I know the first one, operational manager, is incredibly busy, but if you have got, or you are an operational manager, or you know someone who would be really keen to help input into this work, please let us know. Likewise, delivery and transformation leaders as well. We also noted that allied health professionals weren't reflected in the existing personas, so any AHPs who want to have a conversation with us will be very welcome too. Lived experience, we've already had a few conversations with some lived experience partners, but again, if there's any other people who would want to get involved and share your experiences and to inform a persona similar to the ones that I've just outlined, that would be great. And we're also working with HQIPs who seek people who are really involved in developing the findings to understand things from their perspective as well. So that's a big ask. I can't tell you how important it is to find these people, just have those conversations with, so that we can then inform the next steps. On the next slide, we have just our email address. I think Cam, if she's on the line, will put that into the chat, so you've got it. So yes, if you want to either help inform the personas, help inform the future site and associated activities, and bring your perspectives into this work, please do get in touch. This won't be a success unless we involve the people who are really needing the important work around implementing those findings. So I think that was it from me, and I'll hand back to Vicky, I think.
Lovely, thanks, Helen. Yes, we need the doers on the ground, don't we, that to really take this piece of work forward with you all to make sure we get this right so it supports us. So I'm going to ask Marina if we've got any questions in the chat at all for Helen.
Just one. Could we get a template invitation to send to each of the groups for interviews, please? Could we get a template invitation to send to each of the groups for interviews? Yeah, is the question. Yeah,
we definitely can. Yeah,
really useful.
Super. And then there was just a comment saying Deepti sounds like a junior doctor.
That's what I thought.
Yes. Yeah.
Brilliant. Thank you. That was really, that's really good for us to keep everybody up to date with how as it's progressing as we're moving along, Helen, I think, just to make sure that we're getting this right. It was a really good update. Thank you. Okay, so we're on about 12:10, I think, aren't we, Marina? So I think the slides have gone down again, but if they could go back up, that would be great, because we thought we'd touch on quality accounts just really briefly with you. And actually, just hearing some of the questions that came up as well for Caroline and Kim and Helen in the HQIP update, it probably is fairly timely for us just to do a little bit of a whistle-stop tour through the clinical audit section of Quality Code to find topics to include in the quality accounts section, or how they go about actually getting the figures. So with it being March, as we've said, it's pretty timely just to do a little bit of a recap. We don't claim to be absolute experts on this, myself and Marina. We very much come from our own organisation's perspective. I'm from acute, Marina's from community. We know we've got people coming from mental health backgrounds, and in terms of mental health organisations, independent sector, anybody that's providing those health and care under an NHS contract. So we'll just move on to the next slide. What I thought I'd do is just briefly give you a little bit of background again on what a quality account is before we look maybe a little bit more specifically at the clinical audit section. So quality account, then, it's a report. We have to produce it every year, so it is annual. It includes a review of the quality of the services that we provide by our own organisations. So that means for any provider of health and care, regardless if you're NHS, private or third sector, you have to then produce that quality account. So if we look at the next slide, it's the so why and how will this quality account be used then. So primarily, it's about monitoring the quality of our services. It's an assessment of where we think we are achieving and where we need to make it even better. Where we do need to make it better, that we're showing we're committed to that continuous improvement culture. We're identifying areas that we want to prioritise for that coming year as quality improvement objectives, and some of those might be clinical audit. We have to focus on the 3 areas of quality, which is safety, experience and effectiveness. And the quality account is very much a factual report of this. It's published publicly, it's a transparent document, it demonstrates our commitment to quality and improvement, a continuous commitment, not just that snapshot in time. So as always with clinical audit, the quality account is no exception. It should go beyond providing that assurance to regulators. It should be more of a showcasing of our commitment to continuously monitoring the quality of our services and making sure that we're resourcing areas where actually improvement is required. So if we look at the next slide and take that a step further, then how can it be accessed? Each organisation's quality account will be published. We should also make available hard copies and also display notices of how everyone can actually access that copy. So usually on the internet via the provider's website, but also on display in that health and care setting itself for those that don't have access to that internet. So who might use it then? People that access and use our services, they may well choose where to go based upon a quality account and how they actually perceive the quality of the services to be. We know regulators when they're inspecting or reviewing our services, and commissioners as well, in terms of reviewing and assessing if we are actually doing what they're technically commissioned us to deliver: value for money, efficacy, quality. In terms of what it might tell them, it's probably telling them where we're doing well, where we may need to improve, and what actions we have or are taking, and who we've actually involved in the monitoring of the quality of our services and how as well. So if we move on to the next slide, it's looking at if you are involved in developing your clinical audit section then of your 22-23 quality account for your organisation, you may find it helpful to access some of the links that we've included in the slide pack. So if your organisation delivers services under that NHS contract, if you've got more than 50 staff, if you've got an income greater than 130,000, then you have to produce a quality account. If you're a foundation trust this year, the quality account doesn't have to be published as part of your financial account now, but as a separate report. And previously, we've also had to obtain an independent auditor report on our final draft quality account before it gets published at the end of June each year. That's no longer an expected requirement, but locally organisations are agreeing what that process should be. And now we've got our ICBs in place. They're now firmly in situ. They will now decide how each organisation will publish their quality account. So providers should be working closely with their ICB to agree this. So you might find it helpful to access the 22-23 planning guidance in the links that we've included in the slide pack. So if we move to the next slide then, and we can look a little bit more closely then in terms of the clinical audit section. So this section's quite prescribed. It covers, they call it the clinical audit section, but actually it covers clinical audits, registries, confidential inquiries and other outcomes programmes. Quite prescribed as I've said, but it does include the number of clinical audits and inquiries, registries and outcomes programmes that we were eligible to participate in. Then out of those, how many did we participate in? Reasons why we may not have participated, number of reports published that we've reviewed, and then actions for improvement that we are planning to take or that we have actually taken and implemented as a result of participating in those projects, but also reviewing the published reports. So the regulations behind the quality accounts, they don't require us to participate, but they do require us to report if we have or if we haven't and why. And this is what Caroline touched on in the HQIP update. So the NACAPOP, the National Clinical Audit and Outcomes Programme projects, these are included in our NHS standard contracts, and our commissioners can impose penalties on our organisations if we don't participate. They are our highest priority of projects, registries, inquiries, outcomes programmes that we must participate in. So if you're struggling with resource, those are your must-do ones. Then you've also got your non-NACAPOP projects. So we just mentioned the Royal College of Emergency Medicine projects earlier. So they're on the quality accounts list of topics, but they're not those NACAPOP ones. So the non-NACAPOP projects, you need to check your local NHS standard contract with your commissioners as well, because they might have prescribed you to participate. So you need to find out in your own organisation what you've agreed locally with your commissioners so that you know when you're reporting what you should have been participating in through year. And we'll touch on this a little bit later in a later slide about being proactive rather than reactive. So if we move on to look at what this section looks like then. It is quite prescribed, as I've said, in terms of what we have to report on. We have a set of prescribed statements, and you can see the three statements here, where an organisation has to actually fill in their exact numbers of eligible versus actual submitted. An example of a table where each topic will be included of all eligible topics, and if the organisation participated, and the submission figures, and then also for reports and actions taken. Now, most organisations will have a high number of local projects as well to report here, regardless of the amount of national projects that cover the services that you provide. And I know Marina and I were talking about this last week, and we were talking about our different experiences, and mine from acute. Lists absolutely massive, and Marina was saying from a community perspective, I think you had about five national audits.
I've never had more than 5 as a community provider. I've never had more than 5 to report on. I think this year I've got 3. So obviously, just to make the acute trust folks jealous, then it's a lot more of a simpler process in in some organisations than it is for others where they've got huge reams. Yeah.
Absolutely, but we do know that within our organisations we've got that large programme of local audits as well, and we do obviously have to declare how many of those reports we've reviewed and taken action on as well. So regardless of whether you've got a large national section to report on, we are also looking at the local as well. So if we move on to the next slide then, we thought it might be useful just to share some of those common queries that we receive about the quality accounts, the clinical audit section. And like I say, we're not experts. Our experience is obviously managing to produce the clinical audit section for our own quality accounts within our own organisations, but we obviously know we coordinate those queries that come in either via the NQICAN inbox or via the forum, or they're raised through network meetings and brought to the NQICAN meeting itself. So we thought it'd be useful just to share some of these common ones. It's also worth mentioning again that HQIP have got a guide on their website on quality accounts and a list of frequently asked questions as well. And the 22-23 planning guidance also includes detail around some of this information too, but we thought it's worth sharing with you today. So in terms of thinking about your figures then, and what you're reporting on, we sometimes get asked, how do you decide which data sets you're going to report on in any given year? So that it's a data set that completes by the end of that financial year should be included in this table that you're presenting and in your final figure of numbers that you've participated in, etc. So for those data sets that are still data collecting or submitting into the next financial year, wouldn't be included in this table that you're reporting here. We do get asked as well if data collection's completed but data is still being validated locally into that next financial year, do I include it? And we see there's a variety of this amongst organisations. So some organisations choose to include it. They'll put a little asterisk in with a supporting statement to say approximate figures validating until June 23, say. Some choose not to include it and they report it in their table for next year. Approximate or exact figures, where we've got that final and exact figure, we should include those, and for any that we feel that we're perhaps still agreeing that final submitted or eligible, we should still provide it, but perhaps that supporting statement in, as already mentioned, put that asterisk to stay still validating. Preparing a supporting statement then, because we talked about putting a statement in for any non-participation, or if you might have experienced challenges along the way. So you might have started participating in a national audit and then, for example, COVID hit, didn't it? Or you've got clinical winter pressures that sometimes impacts on you managing to submit your full data set. You really want to be putting in a supporting statement to justify why your numbers might look significantly lower than you've previously submitted, or in terms of your eligible figures compared to what you have actually submitted. So prepare that supporting statement just to put that justification in. I would prepare that with your clinical leaders, your project leads and your clinical leaders, as well as getting that supporting statement signed off within your organisation as part of your clinical audit section, because your clinical teams and leaders need to be happy with that statement of why, either why they've not participated or why they've perhaps not submitted or eligible numbers that they should have done. I touched briefly earlier about the NQICAN audits and then the other national audits that your commissioners might have prescribed within your NHS standard contract as well. So again, if you're putting a statement in to say that you've got a non-participation, it is making sure that as soon as you know you're not participating, that's been escalated up within your own organisation, so board are aware as well, because there could be the penalties attached to it, as we've said. Where do I get my figures from? We get asked this as well, and I think it's a case of internally within your own organisation at the start of the year when you get that quality accounts list published, it's really identifying your audits that you're going to report on and making sure internally you know who you need to talk to, who's going to pull those figures together and how are they going to get that information. So it's looking to your informatics departments, your information services, maybe your ops directors, service managers, and then looking on your HES data as well in terms of your eligible numbers. Externally, for some data sets, we do go out externally to NHS Digital, say we do access some audit providers' online portals to extract that data as well. So you need to identify early on how you're sourcing the figures for each audit, registry or outcomes programme that you're participating in and reporting on. So it's about getting familiar with each project that's applicable to you that you're participating in. So if we move on to the next slide, we've just got a few common questions around the reports section. How do you determine which reports to include in this year's quality account? The guidance states it's any report published in the calendar year. So say for the 22-23 one, reports that are published in the calendar year of 2022 that we've actually reviewed in the financial year of the 1st of April 22 to 31st of March 23. We should be including those within our figures here. What counts as a review? Not just by the project team, it's what's been agreed as your local process for reviewing project reports in your own organisation. It should be a certain level of a group or committee which leads into this question here: what level of group or committee can be classed as having reviewed that report? Some organisations have different processes for national reports and then local reports, but go and see what your process is in your organisation. If you don't have one, now's probably a good time to agree one. Is it your clinical effectiveness or your audit committee say for national reports? Do your local reports still need to be reviewed at that level? Or actually in your organisation, do you agree that it can be signed off, reviewed and signed off at that directorate, care group, divisional level, whatever it's called or termed in your organisation? It's making sure you've had that discussion and you're clear what you're classing as a review, to make sure you're then including it appropriately within your quality account. If it wasn't reviewed by the end of the financial year you're reporting on, then we shouldn't be counting it in within our figures. We know in Q4 we have quite a rush, don't we, of trying to push things through so that we can include them. And sometimes we don't manage to achieve it for all, but it's just been about open and transparent. Doesn't mean it's not going to be reviewed. It might move into April or May. So if we move on then, we know that each organisation seems to take a slightly different approach to how they present their information in this section. It feels quite prescribed in the guidance documents, but we know we often see quite a lot of variation within the tables that are published. And just did a little bit of Googling here just to screenshot a few just as examples. But again, you can do that because these quality accounts are published publicly. If you want to look for some organisations that are similar to your own organisation, just Google quality accounts and maybe the organisation's name, and you'll be able to find it on the internet so that you can have a look and see how they're actually publishing within their table as well. But ultimately, your organisation has to decide how they want to present this information, so it is a local discussion, because if it's not going with how the guidance is set out, ultimately your organisation has to take responsibility for it. But you can see here with some of these organisations, some have literally put a percentage of participation. Some haven't put that in if the national report's not been published, though we know that we can find our submission figures and our eligible of what we should have submitted and come up with a caveat of how well we participated, regardless of waiting for that national report to be published. But like I say, it's about having those internal discussions within your own organisation of how you're going to present this information. But have a look and see, because there is quite a bit of wide variation out there. So if we have a look at the next slide, what we've tried to do is put together a bit of a proactive steps that you can take, rather than it feeling we're getting to Q4, oh my goodness, we've got to produce that clinical audit section for the quality accounts again, which timescales can feel quite tight, especially when we're looking at data sets that might not complete till 31st of March, reports that we might not review till 31st of March as well. It does feel like we're frantically running to that deadline for that reporting period. So how can we be more proactive then, rather than not just being reactive? So we know that quality accounts list is published in January every year. It came out promptly again this year, which was fantastic. We know it can change, as it has done again this year, but then it gets republished, and we know that sometimes we do see movement within year 2, where sometimes audits don't progress to start, and they're put on hold to the following year, or they come off that quality accounts list. So once that list has been published, you can prep and agree your audit programme locally within your own organisation for your following financial year, including any of your commissioner requirements. So you need to check with your ICB now in terms of what else they're putting into that local NHS standard contract. So those are those other quality accounts topics that are on that NQICAN programme. Plus sometimes local commissioners do put on additional national audits on top of that quality accounts list. You'll prepare your next year's table now, so start populating your table that you will report on, when you go into Q4 for 2024, because you can work out which data sets you're going to be reporting on and start to look at which ones are now going to start producing reports in this calendar year that you'll have to review as well. As you're agreeing those audit programmes, you're already identifying if there might be any that you don't participate in. So you know you're going to have to get that sign off at board level for not participating. You know you're going to have to correct that supporting statement. And again, for those that you are going to participate in, it's about that agreement with your clinical teams to make sure we've got the resource to make sure we're effectively participating through the year, and then taking action on that data when it's available and the report's published. So it's almost planning your next year's programme now, scheduling in, so you're starting to populate that table as you go, so that then at end of year you're picking up that table, you're working where you've been working on it through year, you're now completing those gaps of information that won't be available till year end. You can review your populated information already just for accuracy and final checks, and it feels far more proactive than reactive, although we do acknowledge that goalposts do change through year from the national list. There are sometimes data collection dates get extended maybe by the national audit provider, or there's challenges with certain IT portals, etc. We know that happens, but some of that's out of our control, and obviously you'll have your own internal challenges within your organisation as well that might impact. So if we move on to the next slide, it's literally just flagging the directory that Helen talked us through earlier, which was really good, because I thought to myself, I'm going to touch on this, Helen, as we go through the quality accounts. It's really informative, it's updated at frequent points, and Helen's just told us today she's looking at this monthly now. We do get told when it's been republished. Helen does go on the forum and update us on there as well. As I've said, HQIP have got that guide, they've got that frequently asked questions section as well. And just to reiterate again that all the national audits that are included in the directory aren't all supported by HQIP. So HQIP support the NQICAN, but they send out that survey to national audit providers to have their information included here on the directory for us. So we've almost got a one stop for us all to go to find out what we should be looking at to participate in. So if we then have a look at the next slide, what we've done is included some key websites and documents for you, links of some useful signposting to information if you're new to producing that section for quality accounts, or even as a good recap if you like us, where you've been producing that section for quite a few years. It does, the goalpost again slightly change, as they have done for the 22-23 that we've explained in the earlier slides. So it is worth just rechecking every year before you start to pick up that populated table that you've proactively been completing through a year to make sure it's right before you include it in your final draft quality account that your organisation is then going to publish. So I think if we move and have a look to see if we've got any questions on the Q&A platform, it's worth posting them, because even if we can't answer them here, we'll use them and take them forward, and we can update the frequently asked questions document that HQIP have got, that they've also got on the NHS England website around the quality accounts as well. It's just trying to make it more clearer for us all to make sure that we are then doing what we should be doing in terms of producing our quality accounts. So have we got any questions, Marina?
Yes, there has been. So a comment first. Thanks, Vicky. This was really useful and timely. I have a meeting with our contracts team to arrange the QA work for our commissioners. Is it possible to share your slides today to help me prepare for it, please? Thank you.
Absolutely, the slide packs will go straight onto Teams, and like we said, we've got all the links to those documents as well, where we've pulled key bits of informational facts as well, so it should all be there for you.
And then the next one is, do we need to put a summary of all clinical audits in the clinical accounts, or just the action plans from the audits?
I might have been misinterpreted the question wrongly, so tell me if I don't answer it, but obviously you've got your table with everything that you should have participated in for your data in terms of your data collection and submission of your figures. When it comes to your statements on your reports and your improvement actions, again, they're quite clear statements that they're asking how many reports you've reviewed in your organisation for both national and local, and then I think we've popped it on one of the slides that the guidance, the screenshot of the guidance states that because you can have a massive list probably of reports you've reviewed, you don't need to list every single action for every single improvement action plan for the reports you've reviewed, but you might want to pull out some priority ones. So if you start Googling for some examples, some organisations do list tables of maybe 1 or 2 key actions for every report they've reviewed. Some people pull out maybe 3 or 4 examples of national reports and improvements that they've made, and maybe 3 or 4 examples of local ones. So yeah, if you look at the guidance on one of the slides, it does say it could be done either way. I hope that answers the question.
I think it depends on, again, it depends on your organisation and your own organisational setup. If you're a small organisation, you might be able to do a one-line summary of all of each of the local clinical audit projects where you've reviewed the report. Obviously, if you're a large organisation, you couldn't possibly include that, a summary of all the projects. It would just become a humongous document, wouldn't it? So, yeah,
it would.
And then you've got another one in perhaps standardisation of QA across organisations is something NHSEI can include in their review work.
Yeah, maybe that would be good, wouldn't it? I think there was one of the links to, was it the King's Fund that did an evaluation of quality accounts in 2011 after it started in 2010, but I think there's a review going on this year as well, isn't it? I think we've put the detail for one of those links to say that will be out again, so maybe that might be one of the outputs of that review, maybe to move to that more standardised approach. At the moment we're all interpreting the guidance slightly differently when you see how everybody's publishing their sections.
And that's it for questions. You just had a couple of positive comments saying wonderful, thanks, and excellent presentation, really clear.
Oh, good, because you never know, do you? I know that myself and Marina know what we do in our organisations, but it's yes, that's good that it came across clear for you all, and hopefully it will help. So,
oh, one more just dropped in. How do you work out the percentage of data for NQICAN audits when there was not a minimum number of data specified for submission?
Gosh, that's going to depend on each audit, isn't it? Because some ask for all eligible, don't they?
Mm-hmm.
And that's a case of that's where you might need to go and have a look at your HES data to work out actually how many did we have eligible in our organisation, to work out whether you did actually manage to submit them all. It's not always easy and it can take some time to do. So it's worth working with your informatics, your information services departments as well in your own internal organisations. I think the cancer data sets, they don't finish validating until about June time, do they? So it's a case of actually, if you're going to include those, you might put that little asterisk I was saying that actually we're fully validating up till the end of June. I think some of the diabetes ones are like it as well.
Yeah. And then one more, great presentation, thanks Vicky. The HQIP NCA directory is a great resource, thanks, which now contains over 110 projects. Does this number get reviewed? I think acute sector is saturated.
It is, isn't it? I know, and I know that question pops up every now and then on the forum and at various meetings about at what point does a national audit topic potentially come off and something else comes on, because it just feels like you get more and more added, doesn't it? But I mean, those conversations do happen higher up in NHS England, and I don't know whether Caroline and Kim can add further around that in terms of topics coming in and off, because it's part of the commissioning, but they do link to the long-term plan, don't they, and the health priorities for the nation. So they're supposed to be deemed as our highest priority topics, aren't they, for measuring how we're doing in terms of evidence-based care.
And then someone's responded to the previous comment saying we just put a number of cases and don't do a percentage if there's no specific number requested.
It's you do put an interpretation on it, don't you?
Yeah.
I mean, it comes back to the data quality and the data completeness, because you want to really submit as many as are eligible, really, so that we're all able then to benchmark more effectively against our organisations. But then you know that you actually have covered your population within your own organisation when you're taking action on your own local data set as well, don't you? We're putting all this resource into participating. We need to participate well, don't we, so that we're getting the best value of it back out.
Yeah, and then another comment saying that they also just put the number in where there's not a specific number requested.
Yeah. It's worth feeding back, really, isn't it? Because this is the design of the national audit again, isn't it? And I wonder if it does vary between the NACPOT ones and the other quality account ones as well, because I know for your NACPOT ones you go through quite a strict commissioning process. I'm looking at Caroline here. That's
yeah, well, I think that's right. They do go through. They have, obviously they need to be aligned with the long-term plan, other priorities. And Vicky, you might see some of that discussion at the quality board discussion meetings that you can contribute to. For other, I mean, if a professional society decides to set up an audit, they've decided to set up an audit, presumably with the agreement of their members. That's not to say that they'll be mandatory or that they'll even be in the quality accounts, but we will put them on the directory just so people can find it. and know where to link to. But that number isn't within our control. But yeah.
So have we got any more questions coming through, Marina?
That's it in terms of the quality accounts. There's a couple of questions from the previous presentations. I shall move on to those. So Vicky, in terms of NQICAN, first question, do the regional networks still have members meetings? There hasn't been one in the South East for over a year.
Yes, so they do still have meetings. We're obviously working with the network chairs to make sure those dates are out there. We're meeting for our business meeting next week, so we will be covering that discussion to make sure we're getting dates out. We know that a couple of the networks have struggled, so obviously Marina and I are trying to put support in where we can, and it might be that if they're struggling to hold those network meetings in quarter one, Marina and I will step in again just to make sure that we're meeting with you all as NQICAN members. So yeah, watch this space.
Yeah, we did have an interim meeting with the South East South Central Network on the 1st of December. So apologies if that person wasn't necessarily aware that that was happening. And then the next question, Shane, the reimbursements pot has been reduced by around 5,000 and an underspend this year. Would be good to have more funded training / events for network members as money limited for development in local trusts.
Yeah, and we absolutely appreciate that. And our improvement priority that we're working with Helen and the transformation team on will be looking at obviously free events that will be put on by experts in their fields to help us all access that. I know it takes time for us to attend from our own organisations, but obviously there's no cost attached to that. And obviously one of the other improvement objectives that Marina and I will pick up, because we didn't get a task, anybody coming forward to lead a task and finish group, is the Education Training Directory, where we'll do a refresh of that to try to identify what free to access education training is out there as well for people. There's absolutely loads on NHS Leadership Academy as well. They've got quite a lot on there that's free to access. So we'll do a lot more signposting around that. And then obviously we're looking to put on more events through NQICAN as well, but we do want topics from you, because I'm sure Marina will talk about this if I hand over to her, but we do ask for regional network plans in every year through your chair, and if you can identify education and training needs there, what we'll look to do for NQICAN is to put those on as a national event for everybody to join, rather than just putting it on for regions as perhaps we used to. So I don't know if you want to say anything there, Marina, around.
Yeah, absolutely. That's really the vehicle for us to know, you know, as a national network where those common training needs are. You know, if the network chair is able to put in a regional plan, which they should do annually, let us know what the needs of their network are. If we identify something that's common across all of them, absolutely we can do. You know, set something up that would be available to all networks.
Yeah, that would be really good.
But yeah, please do identify those to your regional network chairs, definitely.
Because we've obviously got the plans in for 23-24, haven't we already? But it's not too late. If you're feeding up through your regional network chairs or directly into the nqi.can1@nhs.net address or via the forum, we can be collating those themes and topics, and we can be looking to get that organised.
And then another comment on regional network meetings. How do we involve the ICB and identify the appropriate people to contact?
Yes, so we've tasked our regional network chairs with this, haven't we, since last summer. The ICBs obviously have been in place since July, but they are still finding their feet, aren't they? They've obviously restructured and got lots of different teams in place. So it's about, I don't know if it's particularly for clinical audit, your first point of contact is to contact whoever you liaise with when you're doing your reporting for your evidence through years. So whoever you've set up your clinical audit requirements for within your NHS standard contract. And we all seem to have a key contact person, don't we? I'd get in touch with them first to ask then who the most appropriate people are then to invite to the network. But I know our regional network chairs are busy looking at this as well. They're also looking at the membership to try to align it so that partner organisations within each integrated care system attached to each ICB are meeting in the same regional network, so that your challenges and your successes, etc., you're discussing together, you're all there networking together. We know that we've had a couple of organisations jump over into different regional networks as a result of looking at this. So
yeah, thanks, Vicky. There's a couple of questions for Helen that came in after the Q&A immediately following her presentation. So the first one is, I took part in the interviews with Akendi and testing of the futures. Do I wait to hear from NHSEI or email you?
Yes, I've responded in the chat. I'm not sure if the response has come through, but yes, I put my email address in the chat. So just contact me and then we can have a conversation around that.
Has that gone on the Q&A document, Helen? Because the chat's not live in the meeting.
Oh, okay. I think I've done it in the live Q&A.
Oh yeah, that's it. Brilliant.
Yeah.
Thank
So
you.
hopefully the person who asked that question can see my email address, helen.outhwaite@nhs.net.
Brilliant. Thanks, Helen.
Super, thank you. Then there's been a comment, not a fan of personas personally. It sounds a bit commercial and can encourage stereotyping.
Yeah, I've responded to that one as well. So we're advised through the user research actually by Future NHS, because it's established good practice around setting up online communities in particular. But we'll take those views on board. So I'm happy to have a conversation with you around them. I think the way they can be used is to help people to understand what typical users need, but also, help that people to sort of really think about, particularly organisations, what they're offering and how they meet those needs. But happy to have a further conversation with you around that and explain a bit more about the premise and if there's anything you think needs to be adjusted.
Well, thank you. And then I don't know if this one would be best answered by yourself, Helen, or by HQIP. A comment, will be interesting to see how the NCAPOP outlier review feeds into non-participation.
Yeah, agree. Well, I'll take that. That's what we want to see, isn't it? See if that improves participation.
Thank you. That's it for questions.
Brilliant. So we can collate that Q&A document, and we'll make sure that we get that out there and published, and obviously the slide pack and the recording will be made available so that you can share that widely with your team, and obviously we'll make sure that we get the message out in case anybody's not been able to join us today. Unfortunately, we did have to rearrange at short notice from last week, so we appreciate that not everybody will have been able to attend. Next open meeting is the 29th of June, as we've said, so that date and time's already out there, and it's the week following Clinical Audit Awareness Week, so hopefully we'll all still be full of energy from the week before and enthused. But otherwise, I think that's pretty much it for today, isn't it? So thank you everybody for coming and speaking, and everybody for coming in and listening and putting forward with your questions as well. But I think we've probably all gained back about 13 minutes. So thank you very much. It was lovely to see you all. I know I can't necessarily see everybody, and I'm sorry that you couldn't see me at the start of the meeting, but look after yourselves, and we'll look forward to networking with you on the forum and via future events.